Thank you. So, I work for IAVI, and we're a non-profit. We're dedicated to developing an HIV vaccine, and we work in the US, an office in London, obviously. Much of our overseas work is in sub-Saharan Africa, and we have an office in India as well. Our activities range from really broad, so from education advocacy around our work through to fundraising, basic research as well. So a really broad approach. I think we're quite unique in doing that, the whole end-to-end. So we do the field work where we do community education around HIV through to clinical work. We distribute antiretroviral drugs, and we also develop prospective HIV vaccines. Sure. So, like Emma said, my background is I'm a computer scientist. I've worked in informatics in a few fields. I'm definitely not a statistician or a data scientist, and definitely not a clinician. So my role is really to try and bring IAVI forward in terms of doing data science. We're very good at traditional laboratory science and drug development, but we're sitting on a great resource in terms of infrastructure and data that we think could be better used to expedite this vaccine development initiative. So I've just come back from Uganda, meeting the people doing the research, and thanks to the UK's Medical Research Council, there's a great medical informatics unit there, but also a real contrast with the communities that HIV hits the hardest. So in some of the most at-risk communities that we work with, the incidence rate of 25%, and these tend to be in these fishing communities. This is a real sobering read, this paper here about transnational sex. So the women who sell the fish are exploited by the people who buy it, and in an attempt to get the best price, they enter into this relationship. We have a fortunate relationship with the people who buy the produce, and so our work there is really about work on the ground in these communities, providing clinical help and advice. Yeah, enormously challenging environment to work in, and it's a combination there of poverty, lack of basic infrastructure, migrant or mobile workers who spread the disease, and also this a real basic economy there. So how do we bring what is a modern biomedical research organisation? How do we sort of take steps to become a world leader in that respect? Well, I mean, you use data to make sure that you allocate the resources you have really effectively. So we're a non-profit. Our resources are limited, and we're fortunate enough to receive money, most of our money, from the US foreign aid budget. But we have to allocate that really effectively. And in terms of research, it's about how do we get people collaborating effectively, so the people on the ground right through to the laboratory scientists. And how do we do digital science effectively? I mean, everyone's struggling with this a bit because it involves bringing people together who traditionally might have worked quite independently. So we kind of thought, well, what can we do? How can we do a pilot project? So Tableau is a way to bring data to put it in front of people, ideally inspire some new collaborations and thoughts. And so we tried to look at 3 use cases, which is about how do people find data effectively, and how do they ask and validate hypotheses in research, and how do we get people talking and collaborating and sharing data. So we worked with Interworks, actually, who are kindly hosting the event tonight, and they helped us develop some dashboards which we think address some of those questions and ideally inspire the researchers and people who run the organisation to see how things could be improved. So we've got some really basic stuff here, geographics. So we have our clinics in 5 countries in Africa, and we've got the different types of strains of HIV that affect the incident populations there, and just the enrolments on these studies. So yeah, the size of the circle is the cohort. Yeah, and you can see some countries have more than one site. This one is one that's inspired the most interest, I think, because we have volunteers on these studies who attend lots of clinical, who make lots of clinical visits, and at each visit we take blood samples, and then we can track disease progression. So each of these lines at the top here is a volunteer, and all the times they've attended, and they can be either scheduled or unscheduled. And at each point, we can see how the disease is progressing in terms of how it's affecting your immune system. So it gradually depletes your CD4 counts, which makes you susceptible to opportunistic infections, AIDS, which is ultimately what causes mortality. And then we also have here the viral load, which is the virus in your blood. And you can see here when someone starts taking antiretroviral drugs, the CD4 count elevates slightly, at least stabilizes, and the viral load depletes significantly. And we've got some more stuff about sample inventory at each of the sites, so we can see who's actually tracking labeling samples effectively. So this is about organizational processes and how we can improve the workflows. So just to finish, I wanted to just recognize some work. This is Hans Rosling, who published this really influential work, 2009. He died just a couple of weeks ago, but this is a really great TED talk that I recommend people watch. Some people have tried to reproduce this in Tableau as well, on Tableau Public. But it just shows economic development versus incidence rates of the disease. And it shows that this is a really complex problem because there are some countries with very low income who have high incidence rates, and kind of vice versa. It depends on public health priorities in the relevant countries and how they distribute drugs and that kind of thing. So that's really interesting. And I mean, this is going to be a long journey for us. We're just getting started. I think it's going to take us 5 years to develop really effective tools, advocate their use, deliver something that works, and then turn that ultimately into research outcomes, which is ultimately the holy grail there. And we've got issues around our use of Tableau, which has for the most part been great, has challenges. But really, these aren't technical problems, they're people problems. Like, how do we get people to share data and not try and hoard it for themselves? And how do we actually aggregate the data from all the disparate sources? So that's it. If anyone wants to hear more, then do grab me afterwards. But thanks.